My name is Dr. Patricia Bennett. I'm a surgically trained podiatrist and I specialize in complications of the diabetic foot and advanced wound care.
My name is Dr. May Della Casada. I am board certified in emergency medicine with a subspecialty in medical toxicology.
I'm Dr. Sandra Days Adams. I'm a molecular virologist and professor of biology.
Good morning. My name is Dr. Erica David Park, and I'd like to welcome you to the virtual conference on health disparities in diabetes, hypertension, obesity, and COVID-19 complications. This is brought to you today by the Williams Forum for Diabetic Education and Healthcare. Now, to tell you briefly about myself, I am a board-certified specialist in physical medicine and rehabilitation. To give you a bit of background about the Williams Forum, the Williams Forum for Diabetic Education and Healthcare is a nonprofit that was founded by Dr. Patricia Williams Bennett in 2013. The mission of the Williams Forum is to reduce and eliminate healthcare disparities in the greater Newark, New Jersey area, along with other predominantly African American and Latino communities. Diabetes in particular is the main focus of the Williams Forum. And according to data by the Centers for Disease Control, 34.2 million Americans, or just over 1 in 10, are diabetic. An additional 88 million are pre-diabetic. Now, diabetes can be managed when it is diagnosed early and treated appropriately. However, when it's left untreated or poorly treated, there can be many complications. The Williams Forum is strongly committed to effecting positive change in healthcare. We strive to make underserved populations stronger through educational and health forums that benefit our communities. Of note is that the Williams Forum relies entirely on grants and donations to fund all of these activities. So when stay-at-home orders were put in place as a result of COVID-19, there are some people who were able to telecommute and just work from home and continue doing their normal jobs. However, for someone who's an essential worker, that's not an option. Due to the nature of their work, essential workers had to actually go in and were exposed to more people and more likely to contract the virus as a result of that increased exposure. So we can end up with a situation in which a younger essential worker has to go to work, may contract COVID-19, may experience a milder case of the virus, but then they live in a multi-generational home and will bring it home to an older member of the family who could develop a more severe case or potentially a deadly case. Poor nutrition unfortunately results in poor health outcomes, such as increased rates of diabetes, increased rates of obesity, increased rates of high blood pressure. So these increased rates of these chronic illnesses would have an impact on the situation with COVID-19. And the healthcare system itself can, unfortunately, be part of the problem. Some who are racial minorities do not have health insurance at all. So today, we have a panel of experts who can help. We have on our roster Dr. Patricia Williams Bennett. We also have Dr. May Della Casada. And last but definitely not least, we have Dr. Sandra Adams. So now I'm going to give our esteemed panelists a chance to tell a bit about themselves and the work that they do. So I'm going to start first with Dr. Williams Bennett.
I am a surgically trained podiatrist and I am concentrating on diabetic foot care and wound care. Dr. David gave some information about the overall economic burden of diabetic foot infections, $327 billion a year. And this represents Medicare costs only. Now, of this $327 billion, $9 to $13 billion per year is spent on diabetic foot infections and complications. Elevated blood glucose levels, kidney disease, diabetic retinopathy, loss of vision are also complications. However, they are not always directly visible. The loss of a limb is visible. Now, ethnicity is directly related to nutritional preferences. Historically, salt, sugar, fats have been the mainstay of the African American diet and for many other ethnic groups. Flavor and texture are critical to their cooking habits and their palatable preferences. Untreated ulcers can lead to osteomyelitis, which is a bone infection that is detected using various techniques, including an MRI. Gangrene can result in an unsalvageable limb, a limb that can be saved and must be amputated. Depression can follow, and also the loss of additional digits or limbs. With any medical complication, prevention and early detection are critical. And this is particularly important in limb salvage. Diabetes is not just having a little sugar. It's a massive, complicated disease. Don't become a victim. Get educated, seek knowledge. Conclusively, the rules for foot care will be posted on the website, www.wfdeh.org. And thank you for listening. You're invited to future health education forums.
All right. So now I'm going to move on to our specialist in emergency medicine and toxicology, Dr. May de la Casada. So Dr. de la Casada, from this perspective of an emergency medicine physician, how would you say is the best way for patients with chronic disease like diabetes, high blood pressure, obesity, how can they empower themselves when they're going into the emergency room?
So one way that patients can find themselves in the emergency department is, of course, for their chronic diseases. And in these trying times of COVID-19, and even before these times, patients can take the opportunity to reach out to their primary care physicians or their specialists to reach out to us in the emergency department so that we can facilitate their treatment. One of the major questions a lot of patients ask is, when do I need to go to the emergency department, or when do I need to see my primary care physician? The most important time to come to the emergency department is when you notice that your oxygen saturation levels are dropping. When that number drops to 92%, we do encourage everyone to come into the emergency department because there are treatments that we can offer. So when you come into the emergency department, we will assess your oxygen saturation, your work of breathing, and whether you require supplemental oxygen.
When would you say it's critical for a patient with diabetes to have to go to the ER?
As far as diabetic complications, if your blood sugars, if you're a known diabetic and you have blood sugars that are out of control and you can't control them with your home medications and you're feeling sick, whether you have symptoms or not, please come to the emergency department.
All right, thank you so much, Dr. de la Casada.
Absolutely.
All right, so now I'm going to move on to our expert in molecular virology, Dr. Sandra Adams. So Dr. Adams, as an expert in your field, right now with the COVID-19 pandemic, what can you tell us about COVID-19, viruses in general, and the vaccines?
COVID-19 is the disease caused by a coronavirus. Coronaviruses are common viruses, and they are made up of molecules called RNA that are wrapped in a protein. And RNA is just an information storage molecule. It's a little different from DNA, which is what we have in our cells to store information. Viruses are what I call molecular parasites. They rely on living cells to replicate, to use your resources, to use your cellular machinery. Now, the virus that causes the COVID-19 disease evolved from other coronaviruses. It's closely related to SARS that appeared a few years ago, but it picked up some mutations. Unfortunately for us, the virus that causes COVID-19 picked up mutations which are very harmful to us. With bacteria, you can treat them with antibiotics. Viruses cannot be treated with antibiotics, so it is your immune system that will stop a virus infection. So it's a delicate balance to find the right amount of information to produce in the vaccine that would induce an immune response and not cause harm. But the problem is it takes a long time to develop those antibodies and those cytotoxic T cells. So when you receive a vaccine, the initial response is to identify the virus, begin to attack it, and send a message to the adaptive immune system, which will then make antibodies and T cells, which will kill the virus later.
Awesome. Thank you very much, Dr. Adams. So how long does the viral immunity generally last?
Generally, viral immunity would be lifelong. Unfortunately, with this virus, we don't know how long the immunity will last. Right now, we know that it's up to about 8 months. Whether the immunity is longer than that, we don't know. This is an area of ongoing research. In order for this virus to continue to persist, it has to have susceptible individuals. Susceptible individuals are any individuals who have not been immunized. That immunization would come either from a vaccine or from, of course, a natural infection. It is much better to be vaccinated to reduce the number of susceptible individuals that this virus can spread to. That is the only way that we would be able to reduce the incidence and come out of this pandemic.
All right, thank you again, Dr. Adams. Excellent advice.
Thank you.
Wonderful. I think we're towards our end here. I would really like to give a wonderful, huge thank you to our esteemed panelists, to Dr. Bennett, Dr. Adams, Dr. De La Calzada, and I'd like to thank you for sharing your expertise and your insights, and also to give a big thank you to the audience for listening. So if anyone has any additional questions or wants any more information, you can reach us at our website, which is www.wfdeh.org. Again, www.wfdeh.org. Thank you very much.